You can see my screen?
Yep, we can see you.
Awesome.
Hold on over here. Host view. Okay. All right, you're all set.
Okay, all
Awesome.
right, we'll start in a couple minutes.
Okay.
I'm Kara Maisha. I'll be introducing the session.
Hi, Kara. Nice to meet
We'll
you.
just give
virtually.
everybody a couple more minutes to travel on in.
All right, no problem.
Great.
Kara, I have a quick question. So will I be able to see the room at all?
Yeah, we're gonna move the camera. Once you start, we're gonna move it so you can see it.
Okay, okay. And there are also, I see people who are online with me as well.
Yep, there's some folks online. Let me see, let me even test and see if we can move the camera right now. Is this to move the camera?
Right. I think when I've done it in the past, I had to actually.
Oh, really? Wait, I'm facing it the wrong way. There you go. How's that?
Oh, that's good. Okay.
Actually, let's just leave it there for now.
Yeah, do you want to leave it there?
Yeah, you don't need to see me.
Oh,
So,
okay.
I'll just give you a verbal cue when it's time to go.
All right.
But now it's a bit noisy because people are traveling in.
And I'm Candy. I'm your online person helper today and closer.
Oh, hi, Candy.
There she is. Awesome. We starting right on the
I'm
note.
gonna switch mics. I'm gonna put my earbuds in.
Oh. Yeah, move on. I can sit behind you.
And I just like it. We're all here. I'm gonna have to bring them back. Yeah, I don't know if it's just like.
Okay.
I know a couple of my colleagues. But it's like, I don't know, there's so. Yeah. That's the lunch.
Well, we can't right now. Welcome, everybody. If everybody could take a seat so we can get started on time, that would be so wonderful. Wow. What an amazing group. Quiet down so fast. So, welcome. Thank you for coming. We're super excited about this session. My name's Kara Feldman Hunt. I'm the Associate Director of the Osher Center for Integrative Health. And we have two amazing speakers today. Our first speaker is Maisha Claiborne, and she is presenting communication that builds trust, that transforms culture and engagement. And Maisha is joining us virtually, so you can see her up on the screen. So take it away. It's all yours.
All right. Thank you so much. Can everyone hear me okay? Yes? All right. I can see the room. And so, but you're very far away. So, well, welcome to the session. I'm Dr. Maisha Claiborne, and I'll share a little bit about me in a bit, but I want to start with a little reflection. And so, and welcome to those who are online as well. I want to start with a little reflection. So, what does it feel like to feel safe, to feel seen, heard, respected, valued, and welcomed? And I'd like for you to just take a moment to remember a specific time when you felt that way, when you felt seen, heard, respected, valued, and welcomed. And as you remember that time, take note of what were you seeing and hearing and feeling? And just kind of think about that for a moment. And contrast that with maybe another time where you didn't feel that way, where you didn't feel seen, heard, respected, valued, and what was happening then. And I'll just give you a moment to reflect. Now back to feeling seen. Imagine what it would be like if you had that feeling walking into work every single day, moment to moment, feeling seen, heard, respected, valued, and welcomed. And imagine how it would allow you to be and what your experience would be. And how would your experience be different or the same from how it is now? Yeah, I'll just give you a moment to reflect on that. And now imagine how it feels providing that for another person in your communication, having them feel seen, heard, respected, valued, and welcomed, and how that feels for them and how that feels for you. And then finally, imagine being in an organization every day, coming to work, knowing that everyone, including yourself, feels that way, seen, heard, respected, valued, and welcome, and is striving to have others feel that way. And notice as you imagine what's happening in the space. What are you witnessing? Now, as you come back to the room, I'd love to hear a little bit of what did you notice in that sort of reflection? What did you notice? And you're welcome to raise your hand, or if those who are in the chat want to put something in the chat. What did you notice? I didn't say that again.
She said she felt more energized.
Yeah. Noticing that you felt more energized. Yeah. Anyone? Yes, cool.
Felt like I could just be myself.
Yes. Yeah. When you were feeling seen, heard, respected, and valued, right? Thank you for taking on the sharing. And so the question is, what is it that has people feel seen, heard, respected, and valued? And that's some of what we're going to be talking about today. So we're going to be discussing some of the elements of our communication and how we come to communicate the way we do. We're going to recognize trust is a basic requirement for connected communication and distinguish how trust impacts both ourselves and patients as well. We're going to identify the things that threaten and those that enhance trust in our communication and behavior. And then we're going to kind of end with some ways that we can cultivate trust and safety with each other. So my biggest intention is to create some food for thought and to leave you with some tools that you can actually walk away with today. So I want to lead with no disclosures. And then I'll share quickly about a little bit about me. So I come to you, I feel like from a little bit different of a vantage point than most in the sessions today. And so I'm the founder of the Mind Your Mapping company. And I was in clinical practice for 15 years as a family physician, focusing on integrative medicine. I have always been fascinated with the brain, behavior, why people do the way things they do, and communication. And even in my clinical years in practice, I focused on communication and creating safety and creating trust with patients. And so over the years, as a physician in my career, I have navigated spaces of not feeling seen, heard, respected, valued, not knowing who to trust, not knowing how to communicate in ways that I could advocate for myself. That's before I did my additional training. And for a long time, I thought it was just me. But when I transitioned out of clinical medicine, I began doing work with physician well-being and speaking inside of residency programs and such. I realized that it wasn't, that people who shared similar identities and experiences were suffering in silence. And what it did was it refocused my role and helped me to know that my role was to navigate the domain of thoughts, emotions, and communication with my colleagues, because I wanted to make sure that they were feeling seen, heard, respected, and valued, and that patients in their spaces were feeling seen, heard, respected, and valued. So that's the vantage point that I'm coming from today. And the values from which I practice are the values of dismantling divisiveness by fostering dialogues that cultivate safety, trust, and communication. So as we talk about communication today, I like to talk about communication because despite what most people may realize, everything happens in communication and communication drives everything. And when you think about it, we're not actually taught how to communicate effectively as children, but we do learn how to communicate. We learn implicitly from our family, from our friends, from our educators, from society, from the media. And we learn from what we see and what we hear, from what we're told, we basically inherit communication is what we do. And what are we taught implicitly? We're taught what to say and what not to say. We're taught how to express or not to express emotions. We're taught how to handle or to avoid conflict. And we're taught how to approach or avoid difficult conversations. So while we may think that we are great communicators, and we may actually be great communicators, oftentimes our communication is limited by who we have implicitly learned it from. Even if we have pursued additional and intentional development in listening and effective communication. So communication is at the center of everything that we do, what we say and what we don't say, what we do and what we don't do, who we choose to be or not be, and how we choose to listen or not listen. And in effect, you're always communicating. You cannot not communicate. Now, this is a talk about communication that cultivates trust. And so in order to be able to talk about that, we have to talk a little bit about the impact of trust, both in as healthcare professionals and workers, and how it impacts the system. So trust impacts us physically, mentally, and emotionally. It's an energy expenditure when we distrust. And that's because trust creates safety, all right? And you might guess, safety is a basic need. It's a basic need just above the physiological needs of water, shelter, food, sleep, and clothing. And that includes not only our physical safety, but our psychological safety, our emotional safety, and our identity safety. We all need to feel safe. So when we feel safe, we can trust. And when we can trust, we can think more clearly. We can communicate more effectively. We can make better decisions. Our experience of ourself is different. And our emotional experience in relationship to each other is better. And so let's look at a little bit how this impacts whole organizations. So when people distrust, they armor up and it gets in the way of the ability to work together and collaborate. Distrust leads to disconnection, disengagement, and disloyalty. And the paradox of this is that distrust can be really invisible to the system if not investigated. Yet it produces a mental and physical drain that comes with a high cost for those who are experiencing it. And so over time, that leads to disconnection and this experience of burnout and feelings of futility and moral injury, and ultimately leaving us in survival mode. That then becomes disengagement over time, which eventually in a system and an organization leads people to leave. So trust is a well-being issue. And this is a graphic from the US Surgeon General's advisory on building a thriving, healthy workforce. And the point of this is just to look at all the levels of the system. If you look, you can see that the breakdown in trust can show up at every level: workplace environment, organizationally, the system level, and the societal and culture level. And we're seeing that. So distrust is a belonging issue. There, 59% of healthcare workers in a study in collaboration with the Commonwealth Fund and the African American Research Institute reported stress associated with dealing with racism and discrimination in the workplace. So it's a belonging issue. It's also a reporting issue. So of that, 64% of healthcare workers from all backgrounds worried about, in that same study, a retaliation for reporting acts of discrimination against themselves, against coworkers, and against patients. So it's a belonging issue and it's a reporting issue. It's also a workforce issue. 1 in 5 physicians say it's likely they'll leave their current practice within 2 years. And if 1/3 to 1/2 of nurses and physicians carry out their express intentions to cut back or leave, we won't have enough staff to meet the needs of the patients. So we know we're working inside of a shortage as it is. And the AAMC has projected that by 2033, there'll be a shortage between 54,000 and 139,000 physicians, with the most alarming gaps being in rural health and primary care communities. So that makes it an access issue, right? And distrust impacts patient behavior. So I'll share with you, and with permission, my sister who has a healthy distrust for the system, maybe an unhealthy distrust. In a while ago, was in the hospital and experienced being pressured to consent to surgery. And when she asked questions, was dismissed, was gaslit, was invalidated. And she recently, last year, moved to Atlanta. And her first visit to an OBGYN that looked like her, because she had not seen one previously, she broke into tears in the exam room as soon as they walked through the door. So it impacts our patients, their care-seeking behavior, their willingness to share fully with providers, their willingness to follow care plans and protocols, and the continuity of care. So trust impacts everything, right? It impacts our workforce, our well-being, health equity, inclusion, belonging, and patient care. When we feel safe to trust, we can, like I said, think better, listen, collaborate, communicate, take perspective, which allows us to express ourselves, explore, connect, and be vulnerable with each other and really be ourselves. So ultimately, when people feel safe and they can trust, they feel safe to be themselves without having to mask, without having to code switch, without the background fear of being judged, ridiculed, or humiliated. However, there's different levels of trust, and often people are asked to be at a level of trust for which has not only not been earned, but for which they are not capable of, given the level of the level of which they're entering the relationship. And so trust is not automatic. Oftentimes, depending on one's background and how people are socialized, there can be an assumption when we interact with people that we are automatically trustworthy or that people should automatically trust us. But we have to remember that because of our lived experiences, our different lived experiences, trauma subject to various isms, discriminations, cultural or historical harms, that trust doesn't come automatically for everyone. That trust is earned. That trust happens over time. That trust looks different for different people. That trust comes from consistent demonstration of trustworthiness. And that trust is not always easy for people. So that is why it is important. So I'm going to go back. That's why it's important that as we listen and interact with people, that our communication our communicating with trust is imperative in our interactions. So here are some behaviors that threaten trust and safety. And we're going to do a Slido poll. Now, I haven't done this in a while. So I'm going to pull that slide back up. But first, I'm going to have you get and I'm going to also put this in the chat too for those who are online, just in case you need it. And then I'm going to go ahead and run this poll. So give you a moment to. All right. And then what I'll do is I'll stop once I see everyone's. So take a moment and we're going to answer this first question. Which of these have you personally experienced? Which of these have you personally experienced that has threatened trust or safety? I see the votes coming in. I'm going to unshare my screen for just a moment so that you can see the poll. Reshare. All right, so you can see the votes have come in. Yeah. So now it's easy for us to be on to answer and to speak from the side of where we've experienced it, but sometimes it's not as easy to talk about where we might be at the source of or have perpetuated some of these behaviors. So this is anonymous. So I'd like for you to think about which of these behaviors have you been at the source of or have perpetuated. Now, the reason I like to ask this question is because I think for both, when we are able to recognize where we've been, where we've been on the receiving end of it, then we can interrupt and name and set a boundary. But when we're able to recognize where we're perpetuating one of these behaviors, we're able to interrupt it, name the behavior, and repair the harm. So this is not for a space of self-judgment. This is for a space of observation, for us to be able to see, and here you can see some of the answers coming up. When you recognize what these things are that threaten trust and safety, that you can begin to interrupt these behaviors. And we're going to talk a little bit more about that. So thank you for playing. I'm going to reshare my slide screen again. And I will be giving you a summary of some of these slides at the end. So how do we begin to build that trust in our communication? Well, we do it a couple of ways. We can build it through listening, and we can build it with our words. So I like this quote because, when I come across it, it often makes me think of something that Dr. Stephen Covey says, which is common sense isn't always common practice. So we're often swayed by complexity when simplicity can be the real mark of intelligence. So listening is one of the first opportunities that we have to create safety. And that's because listening sort of creates our container. It creates it holds a space. And how we mostly listen is to assess right from wrong, to agree or disagree, to judge good or bad, to see what's true, what's false, assessing what's better, what's worse, to seek to validate or invalidate, to waiting to make our point, and often, especially as healthcare professionals, to fix. And there's nothing inherently wrong with that because it's what our brain does. But when we do that, it creates a gap in what is heard and what is said, what is heard and what is so, and it creates a connection gap. And there's a whole reason why we do this, and that is because we have listening filters, otherwise known as cognitive biases. So there's 11 million bits of information coming into our system, our nervous system, at every single second. And our brain can only manage 134 bits of that information. And so it has to chunk it down into manageable chunks. So it does that through our filters of our upbringing, our memories and past experiences, our values, our attitudes, our environment, not to mention the trauma that can perturbate all of these things. And then it creates a narrative of our emotions and our self-talk. And it's only after that that we react, respond, and retreat. And so it's important to understand this because our brain is always creating assumptions. And we listen through those assumptions because we listen through our filters. And everybody is listening all the time through their filters. So you're talking to people who are listening through filters, you're talking through filters. So the first thing we can do is we can begin to expand our assumptions. We can begin to listen from different assumptions. So we can listen. When we listen from different assumptions, we can respect another's model of the world, understanding that everyone carries different models, mental models, and that the words that people use are not always the representation, the image in their mind that they're intending to communicate. And we can also understand that people are doing the best they can with the resources they have based on their experiences and their birth luck and their traumas. And what that does, it expands our listening and allows us to listen with curiosity. How could this make sense for them coming from their model of the world? We can listen for what's important to another. What's important to them that I may be missing or not seeing? And we can listen with the understanding that we are all listening and speaking through filters. Right? And then that allows us, that's listening from different perspectives. And so this is a framework that I often do teach in when I have quite a bit more time. But I want to give this to you because it's a very useful framework, listening from different perspectives. I call it the 3 positions of listening. And the first position is it's your own experience. You have to listen through you have to honor your experience. But the second position, that position number 2, that's right over here, that's listening and seeing and hearing and feeling from the point of view of the person you're interacting with. And that gives us empathy. And then the third position, listening as a fly on the wall through the eyes of the observer, the not connected observer. It gives us the sort of objective perspective. And so I challenge you, as one of the takeaways is to go and try this, because you're going to have this slide with you. Try listening from these different positions from time to time in your next interaction. So the second thing is building trust and safety with our words. And how we do that is when we begin to build trust with our words, creating a container of transparency, inclusion, connection, curiosity, co-creation, acknowledgement, modeling fallibility and vulnerability. We're not like an industry that really does that a lot. Like we're not a super vulnerable industry, are we? Anchoring with clarity, integrity, agency, structure, consistency, right? Integrity is doing what you say you're going to do, keeping your promises. Agency is choice. Consistency, because trust happens with consistency over time. Context, because context is decisive. Consent, respect, and repetition, because repetition deepens our learning. Then we begin to, when we communicate from this way, then we begin to anchor in trust and safety. And so I want to just quickly introduce what I like to call frames. And some of these may be familiar to you, and some of these things may be new. But I like to use frames because frames directionalize our thinking and our conversation. You know, we think in pictures and then we encode into words. And as we have talked about, people have their own filters. So what I may be saying as a picture showing up in my mind may come across completely different to you through your filters and show up as a different picture in your mind. So I like to use frames to help to mitigate misunderstandings, miscommunications that lead to conflict, distrust, lack of safety, and harm. And so frames help us to get on the same page with each other. And there are lots of them, but these are the most common ones that I like to use. And so just to kind of give you some examples, the clarity frame, that's basically clarifying communication. And the clarity frame communicates, I really want to understand you and what you're saying rather than jumping to conclusions. And there are some examples you can see. And then the agency frame, you can see some examples of the agency frame. The agency is giving choice, and it communicates when you use language like this, it communicates, I respect your right to choose, and I'm giving you the opportunity to communicate to me what you need. Similarly, consent frames. The consent frame also communicates, I respect you and your right to choose. And additionally, I'm asking permission rather than telling you, or as we sometimes do, a voluntelling you. And then the yes and frame. The yes and frame is great for sharing additional and altering points of view when in discussion. And it communicates, I respect that you have a perspective. I hear that perspective, and I'm going to share my perspective as well. Not necessarily as a negation or an invalidation or a counterpoint, but as an additional item to consider. And so these are a few frames that you can practice in meetings, because we're always in meetings, in one-to-one interactions with our patients. We can teach our patients these frames too, with colleagues and leaders. And frames like these really can alter the course of communication that could be going off the rails. However, with the language, it's also important to remember that communication is words are only 7% of our communication, 7%. And so the rest of it is tone of voice, quality of voice, facial expression, eye movements, and body language. So we can be communicating with specific words, and our body and our face could be saying, and our tone could be saying something completely different, right? There's a difference between me saying, you good? And you good? And you're good, right? So you can get the world of the power of the tone, the power of the facial expressions. So as much as words matter, maybe even more do nonverbal communications. So with that, I'll just share a quick pathway. Like you can assess and you can educate. So how does this, like I chunked all the way down to the individual level, and that's a lot of that's where I work from, the individual level. Like how do we as people individually build ourselves to be psychologically safe and trusting people? Because at the end of the day, guess what? People create the systems, people create the policies, people create procedures. Like our system is run by people. So you can assess and educate and develop at the individual level, and then collectively create people building personal skills of becoming a person who displays the skills and characteristics of a person who is psychologically safe. And you might imagine this is useful both in the workplace and out of the workplace. So I'd like to share with you something, but before I do that, I want to just kind of get a sense for what you might be taking away from today. It's very short and compact, but I wanted to make sure I gave you some value today. So I'd love to hear what you're taking away from the day. And at this time, I'll also take some questions.
Anyone have a thought, question?
Mm-hmm. And also, I'm looking at the chat too, if anyone's in the chat and wants to communicate in the chat. Where do you see, if you have any questions, what are you taking away? Where do you see the opportunity to enhance communication in your organizations and your leaderships on teams and departments?
Hi, my name is Brandy. I'm one of patient advocates at CVPH. And the question I have is, do you think this communication model would help change company culture or subcultures within a department?
Absolutely, absolutely. I just came from UC San Diego last week, a couple of weeks ago, and we did a workshop on trust and communicating trust and safety. And I put them through, some exercises with them, but then I also put them in a work group. And even in that short time, they were able to identify in their division where continuing to develop themselves inside of this communication model actually creates that safety between people. And I think particularly in a culture where we don't value vulnerability and fallibility, I think those are the two biggest things, but also being self-aware of when we're amplifying behaviors that are breaking down trust. So yeah, this is a model when we develop people who are willing to be developed, then yes, it changes the culture because it changes the interaction between people.
Thank you.
You're welcome.
Oh, thank you. So I'm thinking about a lot of my team, we're all remote. And like
Mm-hmm.
what's struck is that 7% of our communication is words, and we do so much emailing.
Mm-hmm.
Is it just take more time to be building the trust remotely, or do you have any feedback about that versus in-person communication?
Yes. I think that with email communication or digital like communication, it can be tricky. I think that when you're working in a department or a team where most of the time there's connecting by email, that it's valuable to have structured time to, if you can't come in person, to come online. And a lot of times when I've worked with groups where they're completely online, one of the things that you can lead a meeting off with is what we call, some people will call it an icebreaker, but we call it a check-in. And these are meaningful conversation check-ins that allow the opportunity for discussion that is not necessarily agenda related. It's on the agenda, but it's not necessarily agenda related. So that's one way to begin to cultivate those conversations, but also to have specific connection points that are virtually by Zoom. You can, despite what most people think, you can connect by Zoom or Teams or whichever platform you're using just as effectively as face to face in person. But what it takes is a request for people to have their cameras on and a particular way to navigate meetings so that everyone participates and is heard. Does that make sense?
Let's see. I'm going to just see if there's any questions online.
All right.
Let's see.
Oh, I see a couple of Q&As.
Okay.
Let's see.
Yeah.
It says here, what advice do you have for healthcare professionals who serve patients with communications impairments or disabilities? You know, again, when we talk about, I talk about model of the world, it's really meeting people where they are. And also, I know there was a health advocate that just asked a question, making sure they have a health advocate, you know, they have access to a health advocate. I'm a huge fan of health advocates, but I think we have to meet people where they are, and that's why I say, you know, everyone comes from different models of the world, and so when we are able to communicate inside of, as best we can, another's model of the world and empower their advocates, then it helps to build that trust with them as well.
Thank you so much, Maisha. I think we're at time. We really
Yes.
appreciate you. Thank you.
Thank you. Thank you. Oh, one thing I just want to share, just to take a screenshot of this.
Okay, and we are going
Yes.
to transition to our next speaker, Melissa Oliva, who is a
All right.
colleague of mine. So we're gonna move around a little bit. And Melissa, I'm gonna just give you the mic. Do you want the handheld mic? Yes. All right. Here we go. It's gonna be fun. Bye, Maisha. Well, thank you so much for being here. And I feel like I was hearing Maisha and I was like, how wonderful to be here today and hearing all this information that we have had, because what we're going to transition now, it's going to be more about let's practice this. Let's put in practice what we just learned. And it's also very related because when it comes to communication, is there a camera there? Yes, I want to respect the people that is there. Okay, okay,
Yeah.
good, thank you. So, yeah, I'm very grateful for this opportunity to actually experience this with you. And I want to, full disclosure, I am not an expert on the field. I came here to learn with you. So what we're going to talk today, it's about cultural humility, but in the context of our assumptions and how in the way we treat people, we communicate, we understand each other, we have these assumptions and we have these ideas, preconceived ideas of who people are and where do they come from. So do we have the slides? Okay, good. Because I want to use our time efficiently because we have some work to do here. Well, what we're going to do today, we're going to learn a little bit. I don't want to give you too much information because I think that there's a lot of resources online and I think that you can investigate this on your, and we have the great opportunity to have a good group of people here that we could learn from each other. So today we're going to have an experiential journey, and what's going to help us to do it is a methodology called expressive art therapy. So if we can pass the slide. Thank you. We're going to reflect today on the role of how or privilege or assumptions get in the way of our understanding and in the way we treat people. We're also going to be introduced, for some of you, this theme might be, you've been more familiar with cultural humility, and for some of you, it's going to be new. So we're going to have a little introduction here, and then we're going to have fun. I'm wearing you. Should be aware. You're gonna have fun, and we're gonna practice new skills. Because you like that presentation was just serendipitous for what we're gonna do today. I'm very thankful for the people who organized this. So okay, we're figuring out you need the next slide? Slides, yeah. Okay, sorry, we're trying to. That's okay. Online focus. So, okay, let's talk about privilege, assumptions, and stereotypes. I just want to introduce it so we have a kind of like a common ground on this. So the privilege are like this or social cultural status that we hold and that give us advantage, power, and also benefits because we are part of a dominant group. And that could also be in the setting of a health care that you are in a position of where you are the care provider and then there's the patient, right? These privileges are invisible to us in the moment, and we give for granted and assume a lot that everybody knows or have the same access that we have because being part of this cultural norm, we have experienced less barriers in terms of access, education, and professional opportunities too. Our assumptions are our beliefs around people and situations without sufficient evidence. It just comes from what we think that should be, right? And then the stereotypes are oversimplifications that we do about people and situations to a group of people that can lead us to prejudice, it can lead us to discrimination, and it can lead us, unfortunately, to give patients even misleading them in their treatments or giving them bad diagnosis. So it is dangerous, right? Next slide, please. So where do these bias come from, right? Well, the bias are systematic mistakes that we do in our thinking, and they come from all these judgments and assumptions that we have. And I just want to like provide you with these three categories because I found it so fascinating that the bias that we have can be anchoring bias, and that those are the ones that are kind of like confirming what we think that we believe, like. And then there are the sorry, those are the confirmation bias. The anchoring bias are the ones that we do first impression. You see someone and you assume that you already know where do they come, like what do we do? You travel to that country, so you already know about it. You know, it's like kind of like our first glimpse of the situation that many times influence the way we see people and interact with them. And then there's the implicit bias, and those are like probably the most dangerous because those are the ones that we are not aware that we even have. So knowing all of this, and that's why I don't want to bother you. It's like, we know that we have this. We have heard about this. I feel like that we are in a generation of people that we have conversations about this. Next slide, please. But there's also the concept of and practice of cultural humility and how to become cultural humble. Today, I want to present you with these 5 tools or practices or approaches that are going to guide our experience today in the next thing that we're going to do. It's in base of the last presentation. I want you to find ways to anchor what you just heard with Maisha. It's about being self-aware and notice the position of our bodies. Notice what we're thinking and get curious. Ask open questions. When you have an assumption, immediately ask a question about that assumption. And then be compassionate and show your genuine care. Be humble because this is the cool thing. It's okay to not know. It is okay. We will never know what the other person is experiencing, and that is okay. And we are learning, and it feels better to come to a place of knowing that it is okay not to know. We can make mistakes. And then learn and explore. You're here, you're learning new skills. You probably like to travel, try new food, even learning a language or a couple of words in different language that can help people make feel that you care and that you're interested about their background and their culture. So next slide, please. So the expressive art therapy, which is what we're just going to transition to do today. Yeah, I hope I'm getting you curious about it. It's a methodology and it's a therapeutic, educational, and also we use it in coaching and consultation. And basically it uses self-expression, some people call it art, to integrate, to explore, to learn, and also make sense of our cognitive and our emotional world. And what I want to invite you today is to engage your bodies, your senses, your imagination, to do something that it's going to be a little bit creative and allow yourself to get a little bit out of your comfort zone today. Why not? You're here, right? And let's integrate what we just learned in this brief presentation and in Maisha's presentation, building some muscular memory. You know, muscular memory, it's something that we talk sometimes in physical therapy, but it's something that we can practice cognitively and emotionally. The more we practice something, the more we'll be able to do it, right? So that's what we're gonna do today. And I'm gonna pass the slide, please. And we're gonna have a time for imagine and create. We're gonna have a time to share. We're gonna have the time for reflection, and then we're gonna integrate and harvest. I have to say that I wasn't prepared for this setting. I was prepared for a more circular setting, but we're gonna make the best out of this setting, and we're gonna find our way here today. So, okay, so please pass it to the last one. Yeah. No, no, the last one. Cool. Yeah, the next last. Yeah. So we're gonna leave it here, and I want to invite you to stand up, please. This is where it's gonna get interesting. Yes, and people at home, you can also follow up if they're there, and so in places where people don't have instruments and people didn't have ways to make music, that never impairs people to do it. So what people came across is with a universal beat, which is one step, one step, one step, one step. So I want to invite you to, we're going to move this room today. Yes.
Should we?
I try to make it louder. So I'm going to. And then
They won't hear you online, no, Melissa. You need to use that. Sorry, honey.
Okay, okay. So here we are. And now we're going to add things.
Yeah.
Down. And up. Now double. Back, 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 back. That. Clap for everybody. What a wonderful drum. We had a wonderful drum today. So look around and find somebody to talk. Stay up, please, and find somebody to share. And people in the chat can just like express their what from what we just learned was important for you and has something to do with the work you do. And we have just a little bit to share. So find somebody and share what was important about what we just experienced about communication, culture, humanity. Just like allow those things to get out of. Yeah, okay. We're gonna pause it because we have very little time, but thank you so much for sharing this brief and keep an eye on that person that you find because you're gonna need it to practice today. It's gonna be your partner in crime. So I gave you, I think everybody might have a crayon. And if people doesn't have it, please just grab a pencil, the instrument that they bring to write. And I'm gonna ask you not to sit down yet. I'm so sorry, but this is gonna be standing up a little bit. If that's comfortable for you, of course. Okay, so I wanna invite you to think about an object that can be right now with you or that is somewhere in your life that represents an important part of your identity. Think about an object. It could be, I don't know, a comb because I like my hair, the way it looks. It could be my toothbrush because I like to smile. Think about anything that's an object. And now I'm gonna invite you to take your crayon in your hand. Crayon in the hand, thank you. And now think about the movement that you do with the object that you choose. It could be like this, or if it's my shoes. Think about the object. So now do it with your body. Nobody's watching, so just like do it with your body. What's that movement that you do with your crayon? Think about that movement. What is the movement that you do with that object? Right? Got that movement there? Now, write the name in the air of that object. Can you write it like backwards? Okay. Wonderful. So now that you have that, I want to invite you to dance and that we have music, but I think yes, we're going to try music, with this technology. Anyway, I want to invite you to dance your crayon in the piece of paper that we gave you. Dance the crayon. It's not about drawing. It's about dancing the crayon. Dancing the crayon. And you think about the movement of your object on the piece of paper. Yes. Allow the crayon to dance. And oh, we got it. We dance that crayon into a moment. Remember, if it's a rock, it could be like sharp movements, rock movements. And draw them in your paper. Do it on your paper. Allow yourself. Many of you haven't been with crayons lately. I know. Okay. So I think that by now you might have that. And now let's start a conversation with that piece of paper. But it's not going to be a conversation with words. It's going to be a conversation of seeing your image. Look at your image or look at what is in front of you. And notice what it needs to become something that makes sense to you. Add any detail. You can use it at your pen. It might need words for some of you. For some of you, it might need some details.
Okay. And remember that there's always going to be more time for you to finish. If you feel that you need more time. So now that you have something in front of you, I want you to take, now you can sit down. Thank you so much for being so accommodating. And look at your image. And see, we're going to have time for share, so don't worry. Now see what you have in front of you. And think about how was this experience for you. Take some time to reflect. For some of us, it helped us to ground. For some of us, it's just like, yeah, look at it. Look at your image. Think about it. And think if it has something to tell you. Maybe it has a name, pieces of art sometimes has a name. Think about it. Okay, so I think that I see faces of reflection. So now it's going to be time to practice the skills of the cultural humility, but with the partner that we just stuck. And what we're going to do is we're going to share those images with that person without explaining nothing. But the other person will have to ask you questions. And for the person who's asking the questions, and we're going to have 3 minutes each, so you can expand on probably like ask questions about, what is, open questions. What do you see? How should I see it? And while you're doing it, notice your body. Notice the position of your body. Notice what comes to your mind when you're seeing the picture and ask questions about it. Get out of the assumption mood. Ask questions. Get curious. Go beyond what is evident. And let's explore those images. We have 3 minutes each, so the bell is going to guide us. Thank you.
I'm wondering if we could split let's see, it was about, do you do that in PowerPoint or in Zoom? Oh, I'm speaking into the mic right now. We could read our job.
So now is the turn of your partner to share the image. Thank you. Thank your partners for this opportunity to share, to exercise, and to embody your learnings. Thank you for this opportunity. And I noticed that I didn't actually share an important slide with you. For some reason, there was a slide that was not here. Okay. Yeah. Well, thank you. So, cultural humility is a lifelong learning process, and I am so happy to have been able to be here with you. Seeing what I saw was people sharing, what I saw was people listening and laughing and becoming alive. And this is an image that I'm going to treasure in my heart. And I want to share this thought with you. Cultural humility promotes personal growth. And I don't think I introduced myself. I'm a health and wellness coach at the integrative, at the Osher Center for Integrative Health here at UVM. And in my work, personal growth is a very important part of what we do. And what I find fascinating about cultural humility is that it's a process that allows us to acknowledge our challenges and our limitations, and from there see people and partner with them and develop these relationships based on trust and based on empathy. So thank you for daring to change. Thank you for being here. And I just want to invite you to put your art in the tables. If you, yeah, just put it there. And please come up and for other people just look around, look what is in the tables, because I'm gonna do that. I'm just gonna go around and see. So I just want to invite you to stand up and just kind of like look around, look at other people, look what other people did. Look around. Invite you to celebrate the diversity of backgrounds. This has become a very lively space. And before we go, if anybody feels like just share a word about your experience, you're welcome to. Enlightening. Connecting. Surprising. Present. Uplifting. Therapeutic. Multidimensional. Joyful. Loving. Self-abandonment. Thank you very much. Thank you for daring to change. Thank you. Are there questions? I guess we can do questions. So that's we can use the time to question around too if you feel like. Any questions? Okay, okay. Thank you very much. A clap for everybody. This has been awesome.